Meanwhile, health officials in Gaza say hospitals are on the brink of collapse with fuel and medical supplies in critical need. For more on this, let's speak to Doctors Without Borders South Africa spokesperson Monica Genya. Monica, a very good evening to you. Welcome back to News at Prime. What are you hearing about the situation as far as these fuel and medical supply shortages? Because the latest that's come out now from even the United Nations, it's saying that about a third of Gaza's hospitals are not functioning.
Yes, that's correct. The situation remains catastrophic and hospitals are completely overwhelmed. They have been running out of fuel and electricity, and at the moment, very few of them have any access to fuel at all. There's a complete lack of fuel, electricity, and medical supplies all across Gaza.
And there's this fuel shortage because shortly after Israel's retaliatory strikes, it announced a total siege on the Gaza Strip, cutting off access to supplies such as fuel, electricity, water, etc. Some of those services are coming back, but still not enough for the more than 2 million people who are in the Gaza Strip. But where fuel is concerned, even yesterday, Israel was saying, well, that is simply not going to be allowed into Gaza through the aid convoys because they say, well, it'll go towards aiding Hamas. Where does that leave people such as yourself who are trying to save the lives of civilians?
It's an extremely precarious situation. Our medical staff are not able to treat patients without electricity, without fuel to run life-saving machinery in the hospitals which we support. We are feeling exhausted and terrified and powerless to reach our patients at this point.
And what are the volumes of injured people who are going into these hospitals? Because I'd imagine there may have been people who'd already taken ill before the bombardment, but now you've got these emergency cases coming in possibly by the hundreds. Am I right?
Yes, absolutely. We're seeing a great influx of people in need, and our ability to respond to that need is severely curtailed. Like you said, we don't have medical supplies, we don't have fuel, we don't have electricity. In some cases, we don't even have drinking water. Many of the primary healthcare centers are closed now. Even if patients do arrive there, there's not much that can be done for them. Chronic patients are suffering, and we're starting to see complications that will affect their lives.
Mm-hmm. And aid is trickling in. There were the first few convoys towards the end of the weekend that came in. How much have you been able to get into Gaza as far as supplies are concerned?
Very little. Our teams report that it is nowhere near what we need in order to be able to respond to the emergency, and we're hoping that changes very soon.
Mm. And more troubling today, there's been quite a lot of coverage, in fact, on some of the international channels of the situation at the Al-Shifa hospital, the biggest hospital, as I understand it, in the Gaza Strip. It says it's running out of space and fuel. If Al-Shifa, the largest hospital in the Strip, is forced to shut down, what will be the implications of that?
Well, at this point, there's almost nowhere where anybody can go to receive any kind of aid. In Al-Shifa Hospital that MSF does support, there are very few remaining members of our team, and they've been reporting a shortage even in painkillers. So even if we wanted to support the surgical interventions, we have to do that without painkillers. It's a situation that cannot continue the way it is.
And just some of the interviews that have been given by doctors in the last few days, especially, people have spoken about, for example, using vinegar in some cases because they're out of antiseptic, using cell phones for light in terms when it comes to emergency surgery. What sort of danger does that then place patients under? Because, yes, these are quick fixes so that the work can be done or life can be saved, but far from ideal.
No, the situation is absolutely far from ideal. And like I said, it cannot continue the way it is. The people who we are able to reach are not getting the proper medical care that they should be getting. And this will continue until aid is allowed to flow into the enclave. And we can also bring in emergency personnel to replace our medical staff who've been in this situation for the past couple of weeks. And fuel, definitely, fuel needs to be allowed to get into to hospitals.
It's a dreadful situation because you've got the many injured people who are coming into the hospitals, such as Al-Shifa. But Oxfam, for example, says just 2% of the normal food supply for Gaza has been delivered since the blockade by Israel. That poses another, perhaps longer-term health situation, does it not? Because it may lead to cases of malnutrition, especially in kids.
Yes, absolutely. There is a danger of malnutrition. Drinking water is still very scarce. Proper drinking water, if not made available, will lead to diseases, outbreaks, etc. So at the moment, the situation is extremely chaotic, extremely catastrophic, and needs to change.
And Monica, just briefly, what sort of injuries are your teams seeing when people are brought into hospitals such as Al-Shifa at the moment?
Well, we are seeing victims of burns, people who are coming in hoping to get surgical interventions, and then our chronic patients as well. A lot of people are not able to travel safely. There is no safe way to travel up and down, and they have heard that even if they do come into hospitals, they may not get the care that they need. So it's an exhausting situation for our medical staff.
Monica Genya, spokesperson for Doctors Without Borders in South Africa. Good to have your time. Thank you.